In this lesson, we'll take a look at the coronary circulation. So we can think of the coronary circulation as the blood vessels that are going to and from the heart tissue itself. We're going to see that the coronary arteries are going to bring blood, which contains oxygen and nutrients, to the heart muscle, and the veins, the coronary veins, are going to remove deoxygenated blood and waste products from the heart muscle. Right? These are actually like the arteries are these blood vessels that if somebody had a blockage of these arteries, theoretically could cause chest pain or a heart attack even. So they are important arteries to know. Let's start with the coronary arteries first. So in our previous lesson, we saw that the uh, ascending aorta at its very base was a bit swollen, and that swelling was known as the aortic sinuses. This is where the coronary arteries actually come off of the aorta. And I'll show you a picture just to kind of give us our bearings. Here's the ascending aorta. This area right here where it's a bit swollen is known as the aortic sinus, and you can see coming off the right side and going to the right is the right coronary artery, and then going off the left side is the left coronary artery. So what pushes the blood into these arteries is when the ventricles, the left ventricle specifically, when the left ventricle contracts, the pressure in the ascending aorta moves the blood into the ascending aorta. And then even when the ventricles are relaxing, the elastic recoil of the aorta ensures that there's a constant flow of blood into the coronary arteries. All right, and that's my comment over here. Elevated blood pressure and elastic rebound of the aorta maintain the blood flow through those coronary arteries. And those arteries continually need to have blood in them, otherwise the heart muscle will be deprived, and again, that could be a heart attack. So let's do the right coronary artery first. Since it's running to the right, it's predominantly doing structures on the right. It's bringing blood to the right atrium, the right ventricle, some of the left ventricle, and even some of the conducting systems of the heart. We're going to talk about that in a subsequent lesson. These are the kind of like the nervous system of the heart. It kind of coordinates the heartbeat, and we're going to see some of the major structures are on the right side. Now, our right coronary artery has two branches that I'd like you to know. So let's take a look here. Here's the ascending aorta, right, and then the right coronary artery coming from the coronary sinus, and then it runs this way, right in the coronary sulcus. If you remember, the coronary sulcus is the groove between the atria above and the ventricles below. So this right coronary artery runs right in the coronary sulcus, and then watch this. There's a branch that goes down like this. If you follow my cursor, this is the marginal branch right there. That's the first branch I want you to know. Then it goes around like this little piece here. Now we lose it here, it goes to the back, and we see it right here come around the back this way, and then it ends right here as the posterior interventricular artery. That actually sits in the posterior interventricular sulcus. So the artery has the name or the same name as the sulcus, so it's very easy to remember. Okay, so again, right coronary artery coming off the ascending aorta, goes down the coronary sinus. Now take it back, coronary sulcus, which is the groove, and then there's a branch coming off. Number one, this is the marginal branch, right? And then we follow it around, going to the back of the heart. Here it comes around this way, and now it goes down this way as the posterior interventricular artery. Okay, so those are the two branches. The second artery is the left coronary artery. This is an important one because it's going predominantly to the left, supplying the left atrium, it's supplying the left ventricle, and even the interventricular septum. So we're going to see it running to the left, and it also has two very important branches. So here we see the left coronary artery right here. And then right about here you can see it split, it branches. So the first part also runs in the coronary sulcus. We're only looking at the red one, not the blue one. This red one here will go around to the back of the heart. Since it's kind of going in a circle, they call it the circumflex artery. The second branch runs down in the anterior interventricular sulcus. This is known as the anterior interventricular artery. That's what our textbook calls it. If you go to your notes, you'll notice I call it another artery. In clinical medicine, a lot of times it's referred to as the LAD, left anterior descending artery. So you would not be wrong to say anterior interventricular artery or LAD, left anterior descending. They're both used. It's just you tend to hear LAD more commonly in the clinical setting. Now, there are some connections between the anterior and the posterior interventricular arteries. These are known as arterial anastomoses. An anastomoses is just the connection. So what this ensures is, let's say one of the blood vessels was blocked a little bit. These anastomoses make sure that blood is adequately getting to the heart muscle. All right, so we see these a lot in the body. So these would be actual cardiac arterial anastomoses. Okay, so that's what I need you to know for the coronary arteries. Again, right coronary artery, marginal branch here, and then we go around the back. Here's the right coronary artery coming around the back, and then here is your posterior interventricular artery. Left coronary artery comes out, it's short right here, and then it splits. One branch is the circumflex, the other branch is your LAD, or the anterior interventricular artery. Okay, let's finish up this lesson by looking at the cardiac veins. Right, so the veins are draining deoxygenated blood from the heart tissue. I'm going to break it down into anterior veins and posterior veins to make it easy. Usually I have my students in the lab look for these three veins, and I tell them to use the acronym GAS. We're going to see them on the front of the heart. So we're going to read them here from the right side of, the right side of the heart. It's actually the left side of the heart, but we're going to read it from right to left. This big blue one here, running right down next to the LAD, is the great cardiac vein. So that's our G. Then these two blue ones over here are the anterior cardiac veins. They're on the front of the right ventricle. And this little guy over here, going around to the back actually, is the small cardiac vein. Right, so go G, A, S. Now the veins on the back of the heart we're going to call the posterior veins. So let me turn this around for a minute. When we look at it from the back, I always have my students remember PMS. This blood vessel here is the posterior cardiac vein. This is the middle cardiac vein, and then that small cardiac vein that we saw in the front is also in the back. So we can remember PMS. Okay, posterior, middle, and small cardiac vein. Now, most of these cardiac veins that are back here and then also in the front ultimately drain into this big guy right here known as the coronary sinus. I introduced this in the very first lesson to kind of give you bearings that whenever you see that, you're looking at the back of the heart. And the coronary sinus we saw when we did the internal anatomy of the heart, this blood vessel actually opens into the right atrium on the inside. So all of this venous blood from the heart is now going to dump into the right atrium. For the most part, most of the cardiac veins drain blood into the coronary sinus, that big blood vessel, which ultimately empties into the right atrium. The only exception to that rule are these blood vessels here, the A blood vessels, the anterior cardiac veins. They drain directly into the right ventricle, right? They don't go into the coronary sinus. But as a general rule, all the other ones go into the coronary sinus. So that concludes this lesson on the coronary circulation. Again, we have two arteries, the left and right coronary arteries and their branches, and then we have three veins on the front, GAS, great cardiac vein, anterior cardiac vein, and small cardiac vein. And on the back we have three veins also, PMS, posterior cardiac vein, middle cardiac vein, small cardiac vein.